We continue with the second part of two lectures about tumor immunology and immunotherapy. We talked about the weapons from the tumor cells that can, how they use these weapons in order to prevent the immune system from killing these cells. Second way, that how the tumor will become victorious over the immune system is if there are any defects of the immune system itself that will lead to tumor progression. Maybe there is immune defects in T cells or malfunctioning of the dendritic cell system. The immune defects in T cells in cancers. First, there will be alteration in the expression of signal transduction molecules in immune cells themselves. Loss of CD3 chain, T cell receptor CD3 complex. It functions as a signal transducer upon antigen binding. If this chain, if this complex, if any defect of this chain will lead to the signal will not reach into that into the inside of that T cell, will not reach into the nucleus, and there will be no response of these T cells. Third, receptor-mediated apoptosis of T cells contributes to T cell dysfunction. This is another important way of how there will be a defect in the immune system in the T cell that will lead to proliferation of the cancer cells. As you can see, the tumor mass, these are the vessels and the lymphocytes are fast ligand tumor cells, apoptotic lymphocytes. As you can see, receptor-mediated apoptosis of the lymphocyte. How can these receptor-mediated function if there is apoptotic lymphocytes present there with the fast ligands at tumor cells? It will lead to, if there is any defect in that, it will lead to, as you can see, proliferation of that tumor. If there is any malfunction of the dendritic cell system, tumor-mediated inhibition of dendritic cell generation, differentiation, and maturation. Second, functional impairment of dendritic cells. There is lack of expression of costimulatory molecules. هذا طبعا على الدندريتك cells. هذا مو نقول على التيومر cells. احنا قلنا سابقا على التيومر cells. احنا حاليا على التيومر على immune cells اللي هي dendritic cells, or induction of dendritic cell apoptosis by the tumors itself. Now, in summary, how do tumors progress? There is a balance between, as you can see, there is a balance between the defense mechanism and the immunity of the immune system. The cytotoxic CD8 positive T lymphocytes, the dendritic cells, the macrophages, the cytokines, the antibodies, all these are our weapons, our immune system weapons against the cancer. While the defense by the cancer, there may be antigen MHC loss, the T cell dysfunction, the suppressive cytokines, the suppressive T cells, T cells that suppress the immune response, overweighing effector cells, that means the cancer cell will replicate quickly. All these will lead to the defense way of the tumor cells. That means it is dangerous. That means the tumor will progress into a tumor mass, and the defenses of the tumor overweighs the anti-tumor immunity. Now, from all these, now what are the tumor immunotherapy? Scientists thought about how we can manipulate these ways in order to these natural mechanisms in our body in order to win the battle against the tumors. Strategies to improve the tumor-associated immune response. We must think of strategies to improve the tumor-associated immune response by either boosting the components of the immune system that produce an effective immune response. يعني هذه الميكانيزم اللي حكينا عليها من الاميون سيستم اللي هي تحارب التيومر boost these components يعني نعزز من دفاع من الطرق اللي يستعملها الاميون سيستم in order to win the battle against the tumor, or by inhibiting the components that suppress the immune response. احنا مثل ما قلنا either by defect of the immune system or mainly by some mechanisms that are used by the tumor cells. They suppress the immune response. If we can inhibit these components from suppressing the immune system, the immune response will become very effective and can win the battle against the tumor in its early stages طبعا. So as you can see from these two diagrams, from these two balances, the immunotherapy will reverse the imbalance. Usually there is imbalance in favor of the tumor progression. We try by the tumor immunotherapy to reverse this imbalance into the win of our immune system against the tumor progression. So in order to fight or to treat this patient with tumor. Now, what are these strategies to supplement the missing or insufficient immune elements? As you can see this diagram على الجدول, there are immune elements and enhancing or the enhancer that we are using it. If we are looking about the T cells, if we are thinking about the T cells, we usually may think of injection of cytotoxic T lymphocytes ready to kill these tumor cells. If we are thinking of dendritic cells, we may think of what is called the dendritic cell vaccination. If we are thinking of natural killer cells, we may think of injection of activated natural killer cells, which are important cells against the tumor. If we are thinking of the tumor-associated antigens, TAA, we may give some peptides and some tumor-associated antigens vector vaccine. This means to enhance the immune system against this tumor. If we are thinking of effector cytokines, we think of interleukin 2 and interleukin 12 that are important in diverting the immune system toward the fighting of the tumor cells. طبعا هذه اللي كانت هي عبارة عن strategies to supplement حتى نزيد أو نعزز من the missing or insufficient immune elements. اكو strategies قلنا لأنه على اعتبار أنه الاميون سيستم هو أو التيومر سيلز هي تحارب الاميون سيستم أو تسوي له suppression أو blockage. Now the strategies to block the suppressive mechanism. إذا كان الاميون سيستم يحاول يسوي لنا suppression للاميون سيستم، فإحنا بالمقابل نسوي block، نمنع هذه السبرسيف فاكتورز حتى نخلي الاميون سيستم يشتغل على راحته. وهنا تشوفون بهذا الجدول السبرسيف elements والinhibitors اللي ممكن تمنع هذا السبرسيف elements. First, so if we are thinking that there are some regulatory T cells inhibit the immune system from taking its normal function against the tumor cells, so we will try to block their function. If there are dysfunctional dendritic cells, we are trying to block this pathway. If there are some suppressive cytokines, we will try to block potential common cytokine signaling. If there are suppressive factors, we block their function. These are the general principles of what are the strategies to block the suppressive mechanisms against the between the immune system and the tumor cells. Now, the main mechanisms of immunotherapy, in conclusion from this, first there is will try to stimulating the anti-tumor response either by increasing the number of effector cells or by producing soluble mediators that will stimulate the anti-tumor response. Second is the decreasing the suppressor mechanisms, as we said. Third, altering tumor cells to increase their immunogenicity and make them more susceptible to immunological defenses. اللي هو هذا واحدة من الطرق أنه التيومر سيلز تخفي نفسها عن الاميون سيستم، مثلا down regulation of MHC class 1 2 etc. فإحنا we'll try to make these tumors more immunogenic، مثل حالة التيومر associated antigens vector vaccine اللي قلنا. Fourth is improving the tolerance to cytotoxic drugs or radiotherapy, such as stimulating bone marrow function with granulocyte monocyte colony stimulating factor. وهذا يمكن حضراتكم اللي مطلع مع أحد أقربائهم أو كان ياخذ موضوع ياخذ الكيموثيرابي، فإذا تلاحظون بين فترة وفترة أنه يسوون لهم CBC اللي هو complete blood count، حتى يشوفون مثلا إذا كان أكو decrease in مثلا بالRBC ممكن يعوضوه باي بلاد، إذا كان decrease بالبليتلت ممكن يعطوه بليتلتس، إذا كان decrease بالوايت بي سي فهذا لازم ننطيه certain immunological factor اللي هو يحفز الوايت بي سي for growth، مثل حالة الراديو ثيرابي أو حالة الكيموثيرابي. بالحقيقة احنا ممكن إذا شفنا الوايت بي سي كاونت very low ممكن نعطيهم granulocyte monocyte colony stimulating factor حتى يحفز الوايت بي سي for حتى يكون البيشنت not susceptible to infection.